Hi, I'm Chris Lee, and this is Virtually Speaking. Joining us today is Dr. Brad Nieder, who perfectly coined the phrase that describes who he is, the healthy humorist. A very funny MD and a clean comedian who blends healthcare humor with wellness advice and an uplifting message. A graduate of Stanford University, where he was the founding member of a comedy troupe, the SIMPS. Later, he was a medical student of the University of Colorado School of Medicine, with a residency that followed at the Medical College of Virginia. Brad is the co-author of the book Humor Me and is a certified speaking professional who for the past decade and a half has spoken to hundreds of companies and associations, bringing hilarious comedy while delivering facts and research behind that old adage that laughter is the best medicine. So please join me now with the very funny Dr. Brad Nieder. Well, hello, Dr. Brad Nieder. Thank you for joining me on Virtually Speaking. How are you, sir?
I am great. How are you, Chris? Thanks for having me.
Oh, absolutely. This is something I've been looking forward to. You are darned funny, and we book you all the time, and people always love you. So it's always a fun time had by all. So thanks for coming in.
Of course. Thanks for having me. I've enjoyed the series.
Oh, thank you. Thank you very much. Yeah, I think lately, what I'm hearing from clients really is they want to laugh. They want somebody fun. They want something uplifting. They want a message too. So you're kind of the perfect example of that. And I love that. I've always loved that. I learned about you probably over a decade ago that you coined the phrase "the healthy humorist." I mean, I love that.
Well, thank you. Yes, yes. And, I actually have to give credit to another friend of mine, a veteran speaker, Scott Friedman. You know Scott, I believe, and
Yeah.
he was the one who was instrumental as I got into this world of the meetings industry and the speaking industry. He was instrumental from day one for me, a great friend and mentor. And when I said, do you think there's a market for somebody to do both health and humor? And he said, absolutely. And he was the one who said you could call yourself the healthy humorist. And I
Oh,
thought,
he
oh,
named it. Oh,
he
that's
he
great.
he came up with it, and I thought, yeah, it's alliterative, and it speaks to the health side of things, the humor side of things. It
Yeah.
implies that the humor itself is healthy, it's
Hmm.
clean, and I said I like it. So
Yeah.
so I'm going to give Scott Friedman credit for that.
Yeah. I just booked him the other day, and the client loved him, and of course, he's always a great speaker as well, and that's really cool for him to give you that because I know that that's got to be a great. That's so easy. I just people just hear what your name is, and they already know what you're doing right away.
I think they get it right away. Yes, yes, they
Right.
do.
So, what is it that you found over these many years of doing this? And I think probably over 1,000 speeches you've given. What have you found that that people are asking you the most for, or that the reason why you're there is kind of something you hear so much. So many people want you for the same reasons. What is it that you're hearing?
Well, I think it's exactly what we just said. I think over the years, people have liked that combination of health and humor, that old adage that laughter is the best medicine. So whether it's a healthcare industry audience or truthfully any audience, I mean,
Right.
that old adage applies to, it's universal. And so I've been fortunate that that topic, that message is timeless, I think. And so
Yeah.
folks want both the levity and the humor, the clean humor. They also want the wellness advice and good sound medical information. And so, that combination is what has always served me well. And especially now as we're
Right.
living through a pandemic and people are there's so much misinformation and disinformation out there in terms of medical information and wellness information. So, to have a physician who can speak to what's true and
Right.
what is good, valid wellness advice, and to have somebody who can provide that levity when people are now more than ever anxious and depressed and lonely and isolated. So to be able to give some levity and some laughter has been has certainly been in demand.
Yeah. And and somebody who's funny, because I know you're funny. I mean, I know nobody's looking for, Patch Adams really to come in there, but I know that, they're looking for somebody who's also going to uplift the crowd themselves with their own funniness.
Well,
So,
right. And yeah, exactly. That's it. So right, that clean humor, that humor that's comes from the health and wellness world. I mean, we hear so much about the healthcare industry and the frustrations,
yeah.
and to be able to shed some light on the funnier aspects
Yeah.
of the industry, and of going to the doctor, and of the drug ads we see on TV and so forth. Yeah, people, I think, enjoy seeing the lighter side of health.
Yeah, and you're a real doctor. Of course, we should tell people you're not a practicing doc anymore, but of course you were a general practitioner back in the day, right?
Yes, I am an actual physician. I haven't practiced in many years. I don't reveal that usually till
Oh,
the very end of the program. Because I have some jokes about, I just saw a patient, blah blah blah,
oh,
and that. But at the end, I come clean and I tell them, you know what? The truth is, I'm not seeing patients anymore. This is, my patients are now my audiences.
right.
That's how I'm treating people, with good laughs.
Yeah. So what is the research? I mean, there's got to be some eye-opening facts that we don't really know of, but I mean, had there actually been studies done on, Patch Adams, I guess, is famous for doing his studies, but there's got to be a lot of other recent studies that talk about laughter and how it's healing and how even in the corporate environment that can be really necessary.
Yeah, absolutely. And Patch Adams, have you ever booked Patch Adams? He's still around, from what I
I did in
understand.
the old day. Yeah, in the very beginning of my career, I did. Yes.
Yeah, I mean, and certainly the Robin Williams movie, gave him a boost to his career,
Yeah.
and put him in the spotlight again. But I think he's still around. He's got his Gesundheit Institute, I think, in Virginia or West Virginia or somewhere. But yeah, certainly he was a pioneer in using humor and laughter to get people back on track and get their health back on track. And it was a great movie. Love the movie. But you're right, there are studies. This has been studied. Here, that we're in my totally telehealth studio.
I
That's
love
what I
it.
call it.
Totally telehealth.
This is my office. And so I've got some books I reference here. This when I started looking at the studies on humor and laughter and health, I realized that this guy beat me to it, Dr. Roizen. He, Dr. Roy. He and his buddy, Dr. Oz. Everybody knows
Yeah.
Dr. Oz.
Yeah.
That's America's doctor, right? For better or for worse, it's Dr. Oz. But these guys, about 20 years ago, came up with this concept of real age.
Wow.
Right. And so, not your chronological age, not your biological age, your real age, based on what you do for a living, based on where you lived, based on how much you smoke, and so forth. And they went through seemingly every study that had ever been done in the history of health study. They must have had every intern on the East Coast, every medical student going through the studies for them, because they then put an aging effect on all these different health behaviors.
Right.
And the upshot of it was, based on all the studies on laughter, is that people who laughed a lot can feel up to 8 years younger, and consequently live up to 8 years longer.
Wow.
Right. And so that's the bottom line. And I always give people that when I'm doing programs. That's the bottom line. You can add years to your life by if you're laughing a lot. And then we dive a little deeper. Well, how does it do it? How does laughter do it? Pain management. There have been studies on hospitalized patients who laughed regularly. They had a higher tolerance to pain, a higher pain threshold. Here's another book. I try to impress you and everybody else with the books on my shelf in the Totally Telehealth studio. Norman Cousins, Anatomy of an Illness. He wrote this book probably 50 years ago about laughing himself back to health from a serious illness. He said a good belly laugh kept him pain-free for a couple of hours. And now we've got actual studies to support his anecdotal evidence that, yeah, people don't need as much of the morphine and the Percocet. We've got an opioid addiction crisis in this country, and maybe laughter is part of the solution. You get people laughing when they're in their hospital beds and they don't need as much of the morphine drip. So pain management, stress hormone levels are reduced every time we laugh. The immune system gets a boost every time we laugh. That's been studied out near you, Loma Linda University. IgA and T cell activity, right? We've all learned about that the past year and a half. The cells of the body that protect us from all those bad things, viruses and bacteria and the Kardashian family. You know what I mean? So yeah, a number of health benefits. And as you mentioned, also in the workplace, the sociologists, the psychologists have studied it. There's a reason why a number of successful companies, from Southwest Airlines to Zappos to DaVita, have all embraced humor and fun and laughter in the workplace, right? Because they know it makes their employees more productive. It helps with communication. It helps build team unity and camaraderie. So yes, a number of studies across the board showing the benefits of humor and laughter.
Well, my question is, what if there's nobody funny around? What if you can't find funny? I mean, you got to write a book about, how to find funny, because if you're not funny, what do you have to go just turn on a funny movie? I mean, how do you produce a belly laugh? How do you create laughter in an environment where there's, where you're fighting, where you're up against it, in the hospital room or in a toxic work environment or in a stressful work environment? How do you manufacture a laugh?
Well, it's a great question. And yeah, like the boring accounting firm down the hall from your office there. Yeah, you've seen those guys. How are they gonna, how are they gonna be busting a gut laughing during the day? Well, and you mentioned a toxic culture. I mean, it starts with that culture. And again, the companies that embrace some humor and some fun, that allow for it, so that folks aren't afraid of laughing on the job, of being a little silly on the job, right? It has to be encouraged and promoted. And another speaker friend of mine, I remember, Bill Stainton. I don't know if you've ever booked Bill over the years. He was asked the question once: "Can you teach funny? Can you teach people how to be funny?" And his answer was, "You can teach them how to be funnier."
Right.
So folks, whatever their baseline is, you can learn to tell a joke, and for folks who aren't naturally funny, maybe that's it. You get a joke and learn to tell a joke, right?
Yeah.
And like you said,
we're living in a time of politically correct crisis here. Everybody's offended. So it's really hard, I think, to take that risk in these environments, to be funny, because are you going to offend somebody? Are you going to look bad? Are people going to have another thought of you because you went there, or you're silly? I mean, how do you get away with it these days? It's probably harder than ever, but it's more needed than ever.
Yeah, and you're right. And there's a reason why comics aren't going to college campuses anymore, and the cancel culture, and you can't get away with saying anything. Well, there's still clean humor that does not have to be at anybody's expense, does not have to be ridiculing anybody.
Well, give us an example.
An example. What can I say
to a comedian?
We've all had a real education in hand washing these days, right? Absolutely. What are you supposed to sing when you wash your hands?
Happy birthday. Twice.
Happy birthday. Happy birthday. But you're right, because then you have done a good job. You've gotten rid of all the germs. I am a germaphobe, though, so I always sing The Wreck of the Edmund Fitzgerald. That's what I sing. 2 times, as you said, twice, right? The legend lives on from the Chippewa down to the big lake they call Gitchagumi. The lake, it is said, it's 10 minutes long, Chris. It is odd in public restrooms, but I am always very clean, right? Yeah. The guys in the stalls have their lighters going for me, right? Nice. It is great. So look, that's a joke that's gotten a lot of mileage out of during the pandemic. Everybody's had an education in hand washing, and I even go further with that one, and there's more taglines to it. But at whose expense? Nobody's. Gordon Lightfoot, maybe he's the singer of the song. But and I could use American Pie. I can use Hotel California. That's not that. you know, who's offended by that joke?
Right,
Nobody.
right,
So
right.
yeah.
So, and do I remember this correctly? You have a poem you wrote that's about healthy humor.
Yes, yes. So I wrote a poem that has been very, very well received and popular over the years. It is a lot of good wellness advice. Like I said, folks are always looking for good, sound wellness advice. And so it is a lot of wellness advice packaged in to a sing-song children's sort of story poem that people have really enjoyed over the years.
So where can we go online to find that?
You know, it's a great question.
Or are you going to do it for us now?
And I can give you a snippet of it now. Sure. That, you know,
I don't want to put you on the spot. And I hope it's not a 10-minute long poem.
Well, no, I'll give you a snippet. I'll give you the nutrition snippet of the wellness poem. Again, inspired by all the books I read to my kids over the years, right? And so, yeah, here you go. Here's the nutrition pledge portion of my wellness advice poem. It says, I will not eat a lot of sweets. I will not overeat red meats. I'll keep my portions smaller sized. I'll limit salt and all things fried. I will not drink a lot of booze. Instead, plain water I will choose. I'll keep my fats the good kind, like in soy and nuts and beans, olive oil, fish like salmon, tuna, and sardines. Fruits, veggies, fiber, and whole grains are really key. I'll get my daily calcium, my aspirin, C and D. I'll get my antioxidants. I'll eat my lycopenes. I'll eat omega-3s and flavonoids. Now, what that means is I will choose the darker colors for my meals and snacks, like spinach, green, and berries, blue, and tea, both green and black. I'll choose tomatoes, broccoli, garlic, red wine, and I'll win. For purely social reasons, I will never drink white zin. There you go. That's
wow.
That's everything you need to know about nutrition in one little sing-song. There you go.
You've got to make that into a clip because, you know, I'm always writing down, like on Instagram and here and there. Everybody's like, here's the list of the foods you have to eat.
That's
Clickbait
right.
and all that. That puts it all together in one nice shot. Now, I don't know if I can memorize that, but that's really good.
Well, thank you. Thank you. Yeah, like I said, people have enjoyed that. Is it the funniest thing I do? In fact, Scott Friedman years ago.
Not funny at all.
He was great with giving me the Healthy Humorist moniker. But when he heard the poem the first time, he's like, you know, it's not that, it's clever, but it's not so funny. I really think you should lose the poem. And he was quite wrong about that. Over the last 20 years, the poem has been one of the most well-received items I've done. So.
Yeah.
And I teased Scott about that. So even if he watches this and he thinks I'm, you know,
I'm definitely going to tell him he has to watch this because he's talked about. Now, there's something you've done which is pretty cool also, which is the unhealthy eating adventure across America. What's that?
You've done your homework. Yes. So, you know, people said to me over the years when I started traveling and got into this business, the speaking industry, they say, you know, you're going to burn out on the travel at some point. And 20 years in, I have not burned out. I love it. I love it. And it's been hard during the pandemic to not be on the road. I enjoy seeing new places. Yeah. I enjoy seeing old friends in places. And I really enjoy sampling the foods in all the different areas of our great country.
No, that's not healthy because you're talking about
it's
ribs
not healthy. It's
barbecue and pizza and steak.
No, but I'm allowed a little splurge, right?
Okay.
Even the doctor can tell folks you can splurge from time to time. So I've tried the great ice cream all around the country. I've done barbecue, like you say, in Texas and in Memphis and all over, and Kansas City and the Carolinas. I do the cheesesteaks in Philly, and you know, and so right, that's often.
Well, I have a trivia question for you. You started out with ice cream.
Yeah.
So where did Ben and Jerry's start?
Ben and Jerry's started in Vermont, and I have twice visited their factory. And have you been there?
No, I just have heard the stories.
Yeah, it started in Vermont, and they've got their factory there. And they have what I thought was pretty funny is they have a graveyard for their flavors that didn't make it, and there's headstones with a little like poetic verse for each flavor that they introduced, and
love
that,
it.
it just didn't take. So
Right, because not everything's successful that they do, even though it kind of seems like it.
right, right.
And I'm sure you've been to Hershey, which my kids just found out about, my 5-year-old twins. We were just reading a book on America. Every night they want to learn about a couple of the states. Can you believe this? And in the Pennsylvania one, Hershey is there. And then there was 3 little chocolate chips. And I didn't even recognize that they were chocolate chips because it was kind of poorly drawn and they were really big. And my son was like, what are the 3 chocolate chips doing in Pennsylvania? I said, oh, well, that's in Hershey. And I know a lot of events are in Hershey. There's a really cool convention center there. And I've had so many speakers speak there.
Yes, absolutely.
Have you?
I've been there a number of times,
Yeah.
and it's a cool town, and there's a great old hotel there, and
Yeah.
the street lights look like Hershey's Kisses.
Oh,
And yeah, I've been there, and of course I went into, they've got this massive merchandise shop, and I went
right.
in, you can buy all the chocolate and the Kisses, and I was like, well, I want something that's only available here. I can go into a grocery store and get a peanut butter cup or get a Hershey bar. So there were a couple things they said, this is only available. And I forget what it was even, but I came home with my, and gave my kids. Next time I'll send your kids some stuff.
Okay. Yeah. They
Yeah.
like chocolate.
Great.
But anyway, you were saying you go to all these places and you eat all this horrible food and and then you eat your words.
Yes, exactly. So that's what I do. So I will say many of my social media posts, in fact, are, hey, look what I'm eating in Hershey, or look what I'm eating in Philly, or wherever I am. And it is the Healthy Humorist Unhealthy Eating Adventure across America. I guess I'm allowing people, right, to, hey, listen, you got to follow my advice. But from time to time, it's okay to sample some Amy's ice cream or Grader's ice cream or whatever it is in that region of the country. So that's what it is. The hashtag THHUEAA or whatever it is, the Healthy Humorist Unhealthy Eating Adventure across America. That's me sampling the foods all over the country.
Awesome. Well, that sounds like a fun thing to do for anybody. And of course, when you do that, you've got to make sure you balance it out with a lot of greens the next day and
that's
a lot of water.
That's what I do. I've had people comment on that over there. They're like, what do you weigh given what you're eating? And say, no, when I'm home, I keep it pretty healthy. In fact, I lost 15 pounds during the pandemic.
Oh, you didn't gain the COVID 15?
No, I kept it really healthy and exercised, and I lost weight. So
yeah, Peloton actually did very well during the
yes,
pandemic.
They did, and my wife helped them do well.
My wife as well.
Yeah, my wife loves it.
Yeah, and then I don't know if we would have that in our house if it wasn't for the pandemic.
Right.
So these clients of yours today must have a little bit different message to you when they're talking to you ahead of the event. And I know, of course, you, like any good speaker, talks to the client before the event.
Sure.
What are you hearing right now? Like the last 3 months, 4 or 5 months, is it changing a little bit? Are they seeing a light at the end of the tunnel, or are they still kind of bummed out and still needing humor to lift them out of it? What are you kind of hearing right now?
Yeah, no, I'm still hearing that there's a great need for humor and laughter. And look, this is lingering. Delta variant is keeping. I had a number of things scheduled for the fall that have now been canceled or rescheduled or switched over to virtual events. So the virtual events are still happening, and people are still a little wary of doing things in person. So yeah, we're still in the middle of this, and a lot of folks are
over it,
struggling. Yeah, and everybody's over it. Yeah, absolutely, everybody's over it. So there's still the need for, hey, we need some levity. We thought we were going to be done now, and we're not. So we still need some laughs, and we need some healthy humor.
Yeah, and I remember, you brought it up earlier that people book you who aren't in the healthcare industry, and that's important for me to remember, and for people who aren't in the healthcare industry to remember, because you've done an equally great job for those clients who have nothing to do with healthcare, and they're just in whatever industry they're in, and they realize that this is important So, Brad, as we get, through this pandemic and we're getting closer, hopefully, to the end, I know this Delta variant is slowing things down a bit. But as we get towards 2022, are you feeling pretty positive? I mean, you're a physician as well. Are you feeling like with the vaccinations and the amount of people who've gotten it increasing, that we're, in 2022 kind of seeing the light at the end of the tunnel here, and people's outlooks are all kind of looking towards that?
Yeah, I sure hope so. I mean, the vaccines are quite effective at keeping people out of the hospital and not dying, right? I know there's a lot of talk about breakthrough infections, but the fact is these vaccines have been very effective at keeping people from getting seriously ill and winding up on a ventilator and possibly dying. So yes, I think things are generally improving. I hope that there's light at the end of the tunnel, and that we people are so eager to get back to normal. But I think maybe folks will, there's certain parts of the old normal I don't think we need to go back to, right? I don't need to kiss anybody hello anymore, ever, right? I kiss my wife and my kids and my mom and my mother-in-law. And when my Aunt Edna is going to come in with the hands and the hair and the eyebrows and the smooch on the lip, she's getting a fist bump. Edna gets a fist bump from now on. We don't need to go back to double dipping. Right? Wow, we would love our hummus and hepatitis and our chips and salmonella. We might as well have been Frenching everybody at the party. You know what I'm saying? We don't need to go back. So I hope the hand washing we mentioned already, I hope people have learned some good hygiene and we don't spread the germs as much as we did before this pandemic. So I hope folks are going to be safer and healthier once we do get beyond COVID-19.
Yeah, and I think that man, there's so many things I think back on, like, wow, can you imagine doing that ever again? When you think about stuff you did. But I think that there are a lot of new tools and a lot of new, hopefully, introspective things that people will come away with here, where they looked at their health and they said, am I eating right? Am I in this high risk, category? I want to get out of that. And if some people said, well, it's too late if you're not out of that. Well, but this thing has taken a long time. So you really can do a lot of good work on yourself. And obviously the message that you're bringing to everyone is one of the things you can do that will help your overall health is try and find the funny side of everything, really. And
that's right. I even wrote you a script today, Chris. There you go. Take a screenshot of that.
What does it say?
Take it to Walgreens. Is it illegible? Let me write you another one.
I can kind of read it.
Let me write you another one. Typical doctor with the handwriting. Here, I'm going to give you another one here.
Thanks, Doc.
There you go. Take a screenshot there. Can that focus there?
Chuckle a day keeps the COVID away. I like that.
There you go. That's for you. Take that to Walgreens. Maybe they'll give you some gum. I don't know what they'll give you, but yes, that you got to stay healthy. I like your final words there. Absolutely. And there are some silver linings again coming out of this, that maybe we learn to take better care of ourselves, take better care of each other, and be outside more. And right, there's a lot of silver linings that hopefully will come out of this.
Amen. Yes. Thank you, man. That was so well said. And as usual, you are so fun to hang out with. I look forward to seeing you in person when the time comes, which I know will be sooner than later. And of course, booking you a lot and continuing to get those rave reviews. I know we've got one coming up soon. So that's right. Thanks so much, my friend, for doing this. It's been great to hang out with you today.
Great to be with you, Chris. Stay well. And thank you again for having me.
Absolutely. Take care, buddy.
You too.